Well, hello everybody. Thank you for joining us. Thanks for showing up on a very nice day outside. We thank Lakeland for putting this seminar on, and hopefully we all learn a little bit from each other this evening. My name is Steve Bovenkerk. I'm an ear, nose, and throat doctor. I work with Dr. Habenicht, Dr. Thompson. I'll meet them in just a little while here. And we're part of Lakeland Ear, Nose, and Throat, part of the Lakeland Healthcare umbrella. And we have 3 different offices. We're in St. Joseph, Niles, and Berrien Springs. You may run into us at those offices. A few familiar faces in the crowd. And we're going to be talking about allergies, sinuses, and the Eustachian tube this evening. So those are areas that are pretty closely related to each other. We do lots of different things in our practice, but tonight we're going to be focusing a little bit more on the nose and kind of where the nose connects to the ear in the very back, which is where the Eustachian tube sits, and that's what Dr. Thompson is going to be focusing on tonight. So we obviously deal a lot with the nose. It's in our title of our specialty, ear, nose, and throat. And allergies in particular can be very problematic for the nose. A lot of the times a patient will complain that their nose feels about as big as it does on the picture here, and just very congested and very problematic. So we'll start by just kind of saying what is an allergy. An allergy is something that ordinarily wouldn't give us any trouble, but as it's exposed into our bodies or on the surface of our bodies, it may give us some challenges, some symptoms, just some things that tend to bother us. In the picture are some microscopic pictures of a couple of mold spores, or I'm sorry, those are pollen granules. And pollen is released by almost every plant, and ordinarily if we expose ourselves to pollen, it's not going to cause us any trouble. But for those people who suffer from allergies and allergy symptoms, as we breathe in pollens, as we breathe in mold spores, as those things touch our skin surfaces, there's lots of other examples, cat and dog hair, dander, various foods, of course. Certain people are sensitive to foods that may cause an allergic type of a symptom or reaction in the throat, in the stomach. Even the things we breathe in, those pollens and molds, as we swallow them, can actually upset the stomach. So those are just some basic examples of what an allergen is and a couple of the things that it can do to us. A lot of allergens tend to be seasonal, especially pollens. So pollens predominantly affect us during the blooming seasons, but more specifically, trees tend to pollinate in the spring, grasses in the summer, and weeds in the fall. So lots of people will have different seasonality to their symptoms just based on what is blooming outside. A lot of things will mimic allergies. A lot of people will say they're allergic to chemicals or perfumes or colognes or different hair products or different body care products, but those aren't technically allergies. They behave very similarly. They will cause some problems in the nose and such, but that's a little bit different than a true allergy. So what are some of the things that allergies will cause? Especially in the nose, very commonly they will cause watery, runny nose. Mucus can be thicker, but a lot of times, most of the time, it's more of a thin, clear type of a mucus that comes out of the nose. Allergies can also cause swelling, redness on the inside of the nose. Just make us feel very congested, make us feel like we can't breathe very well through the nose. There's other things, of course, that allergies can affect. Watery, itchy eyes tend to go hand in hand with the nasal allergy symptoms. Even just breathing in those allergens into the mouth can cause some itchiness of the palate, itchiness of the throat itself, and again, even just swallowing those allergens can affect the stomach. So what tends to happen is a lot of people will suffer with these allergies and they want some relief. Allergies that we breathe in typically aren't life-threatening, but they certainly affect our quality of life. So people who have these problems will tend to come into the doctor's office, and it might be a primary care office, it might be an ear, nose, and throat office, and we'll ask that patient questions about the things that are bothering them. What is it specifically that's bothering you? Is it that you can't breathe through the nose? Is it the drainage from the nose? Is it the heaviness and pressure you feel in the face? We will also ask about those eye symptoms, those skin symptoms, and just try to get an idea if this does seem to be a problem because of an allergy. We'll check the patient over. Certainly paramount to trying to figure out not only if this is an allergy, but how we might manage it is what the inside of the nose looks like. We'll take a look in there, and we will often see that redness, that clear drainage, that swelling of the tissues that results from a lot of allergies. Now, that scary looking thing in the picture there, that is our nasal scope. That is a flexible kind of rubbery scope that will pretty much do in everyone who comes into our office with some nasal complaints. And it's very well tolerated. A lot of people are kind of nervous when we start to tell them that we might use this little instrument in their nose. But most everyone, once we're finished, they all say, oh, that wasn't so bad. We can also use this instrument to go a little bit further down and look at the throat and vocal cord area. Before we would put this in your nose, we would put a little numbing medication in the nose, some decongestant spray to just kind of open the nose up a little bit. But this really gives us a good look at the anatomy of the nose, because there's lots of things that may not be an allergy that could be causing some problems back there. The septum, that wall separating the two sides of the nose, is often pretty crooked and blocking one side of the breathing. Sometimes we look in the nose and we'll see polyps growing in the nose. Now, the polyps can be the result of allergies, but before we necessarily jump right to our standard types of treatment for allergies, we want to see if there are some of those blockages, some of those polyps on the inside of the nose that could really be obstructing the breathing. We may have to deal with some of those issues before we talk about just putting someone on our more standard allergy treatment. Testing for allergies. Sometimes we don't even do testing for allergies right away if the history and physical exam kind of supports that this patient has allergies, and we're pretty suspicious of that. We may not do the testing. The testing can be a little bit uncomfortable to go through for somebody, so we don't always jump to that first thing. But often if we've tried some medications, tried some other things, we're to the point where that person is still kind of suffering from their allergies, we'll talk to them about testing for allergies, just try to get a little bit more specific idea as to what might be triggering the symptoms. There are blood tests for allergies. Those tend to be a little less accurate than skin testing. So myself, I personally prefer to do skin testing for allergies, but there are people who just can't tolerate skin tests, particularly younger patients. There are certain individuals with skin problems that we can't do skin allergy testing for. There are certain types of medications that somebody may be on that we can't do skin testing for. But if possible, that's what I would recommend. Now, it is a little bit uncomfortable to go through. You're spending a little time in the office. On the picture here, at the very end of these little white cylinders are small plastic barbs. And what happens is they get dipped into extracts of various allergens, different pollens and molds and cats and dogs and dust mites, just some of those things that we'll test for. And then we'll place these white pieces on somebody's skin and we'll measure the reaction after a certain time frame. Somebody who's positive, we're going to see red welts start to develop on the arms. And in a lot of ways, patients are actually kind of interested in seeing that because they can see for themselves the things that they're sensitive to. And it tends to be very informative. You're spending a little time in the office. You're usually in the office for an hour or two to kind of go through the testing and have us talk to you about the results afterwards. So once we've kind of established, either through history and physical or by doing some further testing, that somebody indeed has allergies, we talk about treatment options. Sometimes the simple thing to do is just try to avoid the things you're sensitive to. That's not always easy, that's not always practical. But for instance, people spending a lot of time outside, doing gardening, doing yard work, those types of things, taking walks in the woods. If they can avoid breathing in those grasses and different weed pollens and such, that can be very helpful. So even just wearing a mask while on the lawnmower or taking a walk, that can be something simple that can prevent someone from breathing in those allergies and causing some of these nasal symptoms. Even just after spending some time outside, shedding the clothes inside the house right away and getting in the shower right away to kind of wash all that stuff off of you, that can be very helpful to avoid breathing in those things that are triggering the symptoms. Keeping the windows closed can be very helpful. It's not always practical. It's not always easy to run the air conditioner, or you might not even have an air conditioner. But in general, if you can keep the windows closed, all those pollens from the outside aren't coming into the house where you spend most of your time. We'll often talk about medication for allergies. Now, by the time patients get to us, they usually have tried a few things, either over the counter or they've been to one of their other physicians and certain types of medications have been recommended. Antihistamines, which tend to be available in oral form, but antihistamines can also be available in nasal spray form or in skin spray form. You've probably heard of Claritin, Allegra, Zyrtec, Benadryl. Those are all antihistamines, and those tend to alter the chemical pathway in the body and stop histamine. Histamine is one of the chemicals in the body that tends to cause these symptoms. It tends to cause redness and swelling and itching. So the medication form of that, the antihistamine, tries to calm down those allergy symptoms. There are other nasal sprays that can be used, even just saline nasal spray, a saltwater nasal spray to rinse out the nose, get rid of that stuff that you're breathing in through the nose can be very helpful. Anti-inflammatory nasal sprays like Flonase, Nasacort, Rhinocort, those tend to be helpful to decrease inflammation in the nose. We want you to avoid some of the other over-the-counter nasal sprays such as Afrin and Neosynephrine, however, as much as you can. It gets a little confusing because there are lots of different nasal sprays out there. But the decongestant nasal sprays have quite a few side effects, so we actually encourage you to try to avoid those types of nasal sprays. Immunotherapy is the last thing on that list, and that's the longhand of just allergy shots. Allergy shots or allergy drops are ways for a physician's office to desensitize someone to their allergies. Now, it's quite a commitment to go through allergy shots, but sometimes that's the last resort. Sometimes that's the one thing we have left to offer that can desensitize someone to their allergies, try to get them less dependent on their medication, and it does tend to be pretty helpful. It usually greatly improves someone's symptoms, usually about 80% of the time. So just a few resources for you on allergies. You can certainly check with your physician or nurse practitioner or physician assistant. Get some advice from that individual directly, either by making an office visit or just giving them a call if you're already an established patient. Our website, lakelandent.com, has some resources available to you. And just, if you're interested in checking the pollen count, pollen is countable in the atmosphere throughout the day, especially during the blooming season. And just by going to pollen.com or listening to your weather report or looking it up in the newspaper, that can give you a pretty good idea if that's going to be a day that you're going to suffer a few more symptoms, whether you might need to take a little extra medication before going through your activities during the day. Should we do questions now, or do you guys want to wait till we're all done, tie it all together?
Yeah, maybe we should wait.
All right, so we'll have everyone kind of hold their questions to the end, and we'll be happy to answer those. Thank you very much, and Dr. Habenicht will be up next.
Okay, so yes, I am related to Harold Habenicht, who was the allergist in this community. I'm married to his son, and the son is a surgeon and a wound specialist in Sinus. So I'm dealing with sinusitis, which is one of those topics that everybody's concerned about. There's 37 million people in the United States who have chronic sinus problems. $6 billion gets spent every year on sinusitis, and 18 million office visits come about because of sinusitis. It's a very important topic because I'm sure everybody in this room believes they have sinusitis. So I see a lot of sinus problems, and there's a lot we can do about it. But first of all, before we talk about the subject, we need to know the anatomy. And these are the sinuses we're concerned about, the frontal sinuses, the ethmoids between the eyes, and then the maxillary sinuses in the cheek. There's another one directly back from the eyes called the sphenoid. Now these sinuses all drain into the nose. There's very small ostia, or sinus pathways here and here, and here and here, and then the ethmoids. And they are lined by the same mucosa as lines the nose. Together, the sinuses and the nose produces 1.5 quart of drainage every day. So that is a lot. So you wonder what's running down the back of your throat? That's something that we all have. But the problem is, in people who get sinusitis, what's happening is you get a little swelling in this area or in these ostia, and things don't drain. They just sit there. And that's when you get the pressure and the fullness. And that's what makes people miserable. So sinuses are a very important subject. And how do you feel when you have sinusitis? There's a lot of symptoms. There's the facial pressure, there's the nasal discharge, there's the headaches, there's the bad breath, there's nasal congestion, there's coughing, there's sneezing. But you know what? Not all of these belong just to sinusitis. Look at allergies. Look at colds. We all have 3 or 4 colds a year. That's normal. But look what it does. It gives you facial pressure. It gives you nasal discharge, but it is thin. It can give you fever sometimes, it can give you headaches, it can give you coughing and sneezing and nasal congestion. The same thing with allergy. Maybe not to get the fever, but the headaches, you get that clear running water out of your nose, you get the facial pressure, you get the coughing and sneezing. So how are you going to tell the difference between allergies, which Dr. Bovenkerk talked about, and a lot of people have, the cold, common cold that we all get 3 or 4 times a year, and then sinusitis. One of the big things is the duration, over 10 to 14 days, and this. So these are things we have to keep in mind. Every time you have facial pressure, every time you get congested, every time you cough, it may not be the sinuses. It may be other issues that we have to sort out. So how can we prevent sinusitis? Well, what we're preventing is the swelling of the mucosa of the nose that's closing off the sinuses and preventing the drainage. So what are we going to use? We're going to use some oral decongestants. That could be Sudafed. That can be actually some antihistamines like Claritin will help us out there. Benadryl, if you don't mind drowsiness. Gently blowing your nose, getting rid of all of those secretions that are there. Drinking plenty of water, that thins out the mucus so that you swallow it and get rid of it. Avoid contact with things that trigger allergy attacks. These are things Dr. Bovenkerk talked about staying indoors, using masks, those kind of things. And the other thing that has been very effective is using a neti pot. Now I brought some examples of those. The neti pot that you may have seen is like this. You just put distilled water in there in the little packets. And then you rinse your nose out. Everybody knows that good hand washing technique is really important to keep germs down, keep us from getting sick. Well, one of the purposes of the nose is to take out particles. Excuse me. Is to take out particles from the air as it goes by, and to cleanse the air as it goes by so it doesn't get all of those dust particles and those bacteria into your lungs. So if it sits there long enough, it's going to cause swelling, and that's going to lead you into sinus problems. So by using this, rinsing your nose out once a day, you get rid of all of that. If you don't like that, and I think this one is easier, it's the same, it's a flush bottle. Put the little packets in with distilled water and flush out. Just a sec, let me ask somebody to answer this. And the other thing that's really important to sinusitis is quit smoking. Smoking is one of those habits that affect all the nasal mucosa. It causes swelling, causes irritation. And that is often a big factor in chronic sinusitis. Okay, when do you need to see a doctor? When you've had an upper respiratory tract infection that lasts longer than 10 days, and the symptoms are getting worse after 5 to 7 days. These are problems that, these are symptoms that may tell you that something else is going on. Are you developing an abscess? Are you developing a acute problem that needs to be taken care of? The treatment when you go to see a doctor, they will, most doctors will give a good physical exam, and oftentimes will use the fiber optic scope, put it in your nose, look to see if there's pus, what's going on in the nose. And then depending on that, we'll prescribe usually antibiotics such as Augmentin or doxycycline. Nasal steroids are important because they help to reduce the swelling. They help to improve the drainage of those sinuses. And then, of course, the neti pot. That's always helpful. getting rid of the bacteria, rinsing out the pus that's there. It's always going to help us. And then general good health practices. We want to make sure we're getting enough sleep. We want to be sure we're getting exercise. We want to be keeping ourselves healthy by eating well. And we want to avoid smoking. And that will help us to fight off sinus infections. Chronic sinusitis is something, if your symptoms persist for more than 8 weeks, that's pain and pressure, that foul smell, the thick secretions, that's telling us that you're moving on to chronic sinusitis. And you're having some damage of the mucosa itself. It's not getting rid of all that mucus. It's not cleaning itself. And there's blockages of the sinuses. They're not draining correctly. And because the sinuses are blocked, you have a nice, it's like a culture medium. It's warm and it's moist, and those bacteria just flourish. So then that's when you feel worse, and you're getting the possibility of having an infection in the bone. So how many people go on to form chronic sinusitis? And usually it's about 20% of people will have chronic sinusitis and then need to have surgery. The first functional endoscopic sinus surgery, that's a little more invasive, and when we use that, we use scope, and oftentimes we're taking out tissue and some bone. People who have polypoid diseases, they have polyps in their noses, are going to have functional endoscopic sinus surgery to remove that, to remove the diseased mucosa, and to open up the drainage pathways of all those sinuses, the ones that are involved. There's a new surgery, it's less invasive, called balloon sinuplasty. And here we find the little ostia by threading up a little wire into the sinuses, and then a flexible catheter with a balloon on it follows that. And so looking with the scope, we can place that balloon right where we need it in the ostia or the drainage pathways of those sinuses and blow it up. And that moves the bone. Now, it's not a balloon like you think of a balloon blowing up. It's more rigid, like a tire, it's firm. So it's able to actually move some bone and to open those pathways. And it's when you think about it, it's very effective and it's very conservative because you're not taking any mucosa away and you're not destroying any bone. So that's been around for about 10 or 15 years now and it's pretty effective. We're very happy with it. The primary objective of the surgery is to restore the sinus drainage and to remove any diseased mucosa and bone. And of course, if there's any polyps. So, I'm sure you have some questions and we'll wait and do those at the end.
Okay, well, I'm Dennis Thompson, and glad to see everybody here. Everybody looks like you're all still awake, which is a compliment to my colleagues. I'll try to stay awake. I was on the highway coming back from downstate Illinois watching the total eclipse of the sun. It was quite a drive home. So I'm going to talk about eustachian tube dysfunction. Can I see a show of hands? How many people here have ever had plugged up pressure in their ears? Okay, about half. Okay, well, congratulations to the other half that you've never had it. A lot of us have had it on occasion. We're driving in the mountains and we get that feeling in the ears, or the airplane's descending and we get that plugged up, stuffy feeling, and you actually have the sense that you're not hearing as good as you could before you got the feeling. And that's true. If we did a hearing test on you, you're not hearing as well as you did before your ears got stuffy. Well, that's eustachian tube dysfunction. Some folks are unfortunate enough to have this on a more chronic basis. They're not in the mountains, they're not flying on an airplane, but they're just minding their own business and their ears get this uncomfortable pressure, decreased hearing. Sometimes it suddenly resolves by sort of popping open and they don't like it. So a lot of people get it occasionally, and certainly just like other aches and pains and uncomfortable things that we all get with our bodies, not every symptom requires you to rush off to the doctor. But if it becomes something that's driving you nuts, like this lady appears to be quite annoyed, then you might want to see what we could do for you. So a little eustachian tube anatomy. This is where we're talking about. There's the outside of your ear canal where your earwax is, and it stops at the eardrum, and then the space behind here, and then the nerve in the inner ear. But here we have the eustachian tube. So it is an air-containing space back here behind the eardrum, and the eustachian tube connects that airspace to the airspace of your nose, right here in the back of the nose. So that's where the eustachian tube opens. And that's why sometimes you can relieve eustachian tube dysfunction, abnormal pressure behind the eardrum, by holding your nose shut and then blowing into your nose, as if you're trying to blow your fingers off your nostrils. And the ears will suddenly pop open. What you've done is you have backed air up into the eustachian tube, back up into the ear, and it evened up that pressure that was causing your discomfort. So what do we do about eustachian tube dysfunction? There are lots of things that are tried and that have been studied extensively that don't work. Ear candles don't work. Ear candles don't work for anything, by the way, but they don't work for this. This is one of the many things ear candles don't work for. Surprisingly, some of our old standbys for allergies and sinus problems, such as antihistamines and steroid nose sprays, have not been shown to be effective in studies. There have been many studies on them. I think they do sometimes help people who have eustachian tube dysfunction, or at least an uncomfortable feeling in their ears, and also have obvious allergy symptoms. So at the same time, they can't breathe through their nose, they're very stuffy, they've got the sinus pressure, and it's certainly worth a try to see if we get rid of all those nasal symptoms if their eustachian tubes function better. But it's been pretty disappointing in the research studies. So if we can't really get it to clear up with medication or time, I should mention time. You know, time's a good medical treatment, time-honored, goes back thousands of years. Give it a little time, right? Take 2 aspirin, call me in the morning, or just forget the aspirin, and forget the phone call too if you feel better, right? So just give it some time. The studies have shown in our most challenging eustachian tube patients, which is little children, that their eustachian tube problems will, in the majority of cases, 80 to 90%, clear up within 10 to 12 weeks with no treatment whatsoever. Just give them the time. But that's not very good advice if you're miserable. You know? That's okay if it doesn't bother you too much. If you're miserable and you're having trouble hearing and it's very uncomfortable, the oldest treatment was to even up the pressure behind the eardrums. Instead of this way, the eustachian tube, since we didn't have a treatment that really worked, we would do this. We would make an artificial opening right through the eardrum, numb the eardrum up, or put the patient to sleep, and make a little cut in the eardrum. And that was done for many, many decades in doctors' offices. So your parents or grandparents might have had an eardrum lanced in a doctor's office to help with eustachian tube dysfunction or ear infection. The problem with that was that they would heal up very quickly. It's kind of like a scratch. It would heal just in a couple days and then be back where you started from, until the 1960s, when some very clever person thought, well, the problem is that the little cut I made in the eardrum closes too fast, so maybe if I stick a little piece of IV tubing in there, it'll keep it open for a while. And it worked, and years later we're still putting in custom-made ventilation tubes that hold themselves in for months or sometimes longer. and that's extremely effective. You can't have eustachian tube dysfunction, you can't have pressure in that space with a hole here, right? Just like you can't have pressure in your car tire if there's a big hole in it. It's not possible. So that's what they look like. If you look in an eardrum and an ear canal, and you'll see this tube pointing back at you, and you can see right inside the ear. Problem with ventilation tubes is they're designed to come out. The ones that are the least likely to have problems or complications come out pretty quickly. The problem with that is you might have to be putting them back in on people who have chronic eustachian tube dysfunction. The ones that stay longer have a higher risk of complications. So we've been sort of caught in a little bit of a dilemma. So we have a new procedure. It's called Eustachian tube balloon dilatation, and it's a modification, kind of an application of the balloon sinus surgery that Dr. Habenicht referred to for chronic sinusitis, because they share some things in common, don't they? We're trying to keep an opening, a natural opening. We're trying to make it bigger and make a natural opening more open. So we had a procedure where we tried to trim open the opening in the nose here with lasers and other instruments. And I was doing that for 10 or 15 years, and the results were so-so. Some patients got better, some didn't. And this device was perfected by the same surgeon, ear specialist, who invented that other procedure after a lot of research on why eustachian tubes don't work. But you can see it goes much further up. We're not just working on the opening, we're working on most of the eustachian tube to widen the eustachian tube, replace the thick lining with much thinner lining is really how it works by pressure. And the results are much better. Symptomatically, the majority of the patients get rid of their eustachian tube dysfunction. They have intact eardrums, they can go swimming, diving, whatever they want to do, they're back to normal as far as their eustachian tube function goes. This is what it looks like when we're in the operating room. We use a scope, just like Dr. Habenicht talked about and Dr. Bovenkerk, and we're seeing through the scope. This is the eustachian tube opening here, and we've inserted that little catheter. It's got a balloon around it. The balloon is inflated for exactly 2 minutes. Somebody times it for me. And then we deflate it and take it out, and that's the device that the operating room staff hands me so that I can do the procedure for a patient. There's really no recovery to the procedure, except for the shock of seeing the bill from the hospital for the procedure done, of course. And maybe in the future we'll be able to do these in the office and figure out how to get it nice and numbed, so they don't hurt people. But the procedure itself is a very brief procedure. So that's eustachian tube dysfunction.